Dr. Lieutenant Colonel Kamal Kalsi, welcome to ITV Gold. I hope you're doing well today.
Doing great, thank you. Nice to be here.
Well, it's nice to have you. We have a lot of questions for you. So the first question to you has to be about the big news that we are hearing in coronavirus news today. Pfizer has said that it's an antiviral pill that it has made is 90% effective in preventing hospitalizations and deaths. This pill is right now with the FDA, and there may be an emergency use authorization coming very soon. So the question to you is, what is this pill? What information do you have about it, and how effective is it really?
So we don't really know exactly how effective it's going to be, but the basics of this Pfizer pill are the fact that you need to use it within 72 hours of the infection taking place. So if you come to me, let's say to my office today, and you started having symptoms, let's say yesterday, then this pill potentially could be an effective tool again in the fight against COVID, especially for patients that present with severe upper respiratory symptoms.
So how is it different?
And like you mentioned, it supposedly helps reduce morbidity and mortality by like 90%.
Right. So what about the other therapeutics that have been used so far? What information could you give us about that?
So generally speaking, look, if patients come to you and they are mildly symptomatic, which is the case for 95% of COVID patients out there, then their body's going to fight this off within about a week or two. There's really not a whole lot that needs to be done. You treat the symptoms. So if they've got congestion or a minor cough, then over-the-counter is like Mucinex, Dayquil, NyQuil, Robitussin will do just fine for them. Now, when it becomes a little more complicated is if they start developing chest pain or trouble breathing, then those types of symptoms need to be evaluated by a physician right away.
What about the monoclonal antibody? What is that exactly? And also, when should a patient get those?
So the monoclonal antibodies are essentially antibodies that are specific. They've been designed to attack the coronavirus, and then that helps your body's immune system eliminate the infection. So that has been super, super effective. All the patients that I've sent in for monoclonal antibody infusions have done very, very well, even the very sick ones. So again, it's another tool in our toolbox. The vast majority of COVID infections do just fine. But when they do get sicker, then we have monoclonal antibodies and other medications to help get them through this.
Right. Let's now talk about the numbers that are coming in today, doctor. We have more than 50 million cases of COVID-19 in this country, nearly 800,000 deaths. Cases are rising in colder regions of this country, but we're also hearing the same news from other parts of the country as well. How are you looking at this? You are in the ER. What are you seeing?
Yeah, the numbers definitely give me pause. Maybe about a year ago, I had written an op-ed talking about the fact that we may see 600,000 people die from COVID before we get a handle on this. And at the time it was 600,000 people dying from COVID was an unimaginable number, but now we've already surpassed 800,000, and I think we will pass a million in short order, unfortunately. What's going to happen is over the next month or two, we will see a rise in infections, especially from some of these new variants.
Yes.
And that unfortunately is going to happen because people, as they meet over the holidays, they will inevitably pass the infections around. And we've already seen a bump in infections from Thanksgiving, and we will most certainly see a similar rise in infection from the holiday season.
And since you are already saying that we're going to see a surge from the holiday season, what could be then done on a national level, perhaps, to actually control this? Is this controllable, or it's too late?
No, it's most certainly controllable. It's not too late. Uh, Again, it's just common sense things, right? I mean, I think you can still meet and connect with your friends and families over the holidays safely. If you are having any sort of symptoms, if you feel sick or you have a fever, cough, sore throat, whatever, it's better to not participate in family functions. It's better not to go out and spread the infection. But also, if you are going to do this, it makes sense to wear a mask and do social distancing as we had done previously.
And travel is also at the all-time high that we have seen in the last 2 years of the pandemic. Are you worried about it? What should we know about traveling, and how should we prevent ourselves from COVID?
Travel is part of the holiday season, so I think we cannot stop people from traveling. I don't think that's a reasonable request. But I think it's important that people do it safely. So wear your masks. Certainly, if you're flying, you want to keep your masks on at all times. And I hear this a lot from my patients that look, they don't like masks. They don't want to wear them all the time. And I understand. I get it. But this is for our national health, for public safety. There may be a cancer patient sitting next to you, and you would hate to pass on something to them, or somebody with a compromised immune system. You really want to do this for your neighbors, your friends, and your family. We all have to do our part to try to minimize the risk.
So parts of the nation are already requiring masks in indoor public places where vaccination statuses cannot be checked. How important do you think that step is?
I think that's a really reasonable thing to do. Especially if you can't verify vaccination status, then you default to the least common denominator, or the most conservative measure, which is, look, everybody wears masks, everybody social distances, and we know that those very, very simple things have helped to slow down the progression of transmission, and that's going to be the name of the game, especially with the Omicron variant that's come out. It is highly, highly infectious. Certainly more infectious than the previous variants that we've seen. Even though the preliminary data shows that the mortality and lethality of this variant is lower, if it infects more people, we may actually end up seeing more people die from it.
Right. In the UK already, they are starting to have some restrictions in the country because they've already seen a death from the Omicron variant. How soon before the same news we hear in the US?
Look, it's already in more than 30 states.
Right.
And it is just a matter of time. I wouldn't be surprised if we already seen somebody pass away from Omicron variant here. It's inevitable. It will become the dominant strain at some point here in the U.S. And we have to do our part to try to limit the spread.
Yes. You know, on this Omicron variant today, South Africa, where it's been originated from, came up with this news that 2 doses of the Pfizer vaccine were not enough for Omicron. In fact, if my numbers are right, it says it's only 33% effective. But Pfizer says that if a booster dose is added, it spikes that up and it helps the patient that's getting it, the vaccine. Could you give us some insight into this? What is this research? How valid is it?
We don't know, honestly. There's all this research is pending. I know Pfizer's doing their own. I know that a number of nations are looking at this very carefully. So I'm hoping that we will get some clarity in the science of this within the next few weeks. But it does sort of make sense to me that a booster dose will increase the efficacy of the vaccine. So I would encourage everyone, if you haven't gotten the vaccine, please get vaccinated. And if you haven't gotten your booster, if it's been 6 months since you've gotten your last dose of the vaccine, I think it makes sense to get the booster.
So this brings
33% doesn't sound like a lot, but if you're looking at, hundreds of thousands of people or millions of people that get infected, actually that is, it will save a lot of people. And if you get to 50 or 60 or 70% after the booster, that is still, that is very significant. Hospitals and ERs and doctors' offices will most certainly be overwhelmed just because of the sheer volume of infections that we're going to be seeing.
Right. And when we are looking at the vaccines and the booster as well, what do you think needs to be the focus of the administration, the Biden administration right now? Do they need to focus on getting more first doses into the arms of Americans? Do they need to focus on boosters more? Or it's a situation where this has to be balanced?
I think all of the above. And I think we have to make sure that the public remains vigilant, that we don't let down our guard. I think the worst thing that could happen is the public becoming complacent with this infection and not really appreciating how bad it could be. Even though it is less lethal, it can still potentially kill people with weakened immune systems. Apparently, older people are also still at risk. And people of all ages have been seen to suffer from the effects of this new variant as well. So again, it's important that all of us appreciate how bad this could be. If 20 million people end up getting infected with this new variant, that will still translate into ICUs becoming full. And if the ICUs are full with Omicron patients, then what happens to your stroke patient or your heart attack patient or your trauma victim that now needs that ICU bed? It is going to overwhelm the system. So we really do need to do our part to keep the infection rate low.
So then how are you responding to so much misinformation on the vaccine? There is a portion of the population that doesn't believe in vaccine at all. And now they're even more afraid or worried about this COVID-19 vaccine. Now, how do we get to those people? And second, what do you say to all of this misinformation as a medical professional, as a doctor?
Well, so it's interesting. I have, I'm certainly seeing this through the lens of a physician and as a doctor, but I also do a lot of national security work. And so I know that a lot of this misinformation is coming from overseas, whether it's China or Russia or some other state actor. We need to appreciate that if we don't vaccinate our population, that degrades our national security. It degrades our ability to defend our nation, and be who we are. The United States, we're the most powerful nation in the world, and there are people across the world that don't like to see that. So this national health effort has to focus on fighting this misinformation that's out there. I've heard a lot of I've heard probably all of the excuses you can imagine for why people have not vaccinated, and most certainly the people that have not been vaccinated come in much sicker. I have not sent a single person that's been vaccinated with COVID vaccine to the hospital for their COVID infection.
Oh, wow.
Usually their symptoms tend to be mild, but when people come in that have not been vaccinated, their COVID symptoms are definitely much more severe. And I've sent a bunch of those people to the hospital. So, trust me, I've gotten my kids vaccinated, my wife, my parents, it is safe, it is effective. And if you just look at the sheer numbers, there is maybe a 1 in a million chance that you will suffer from a complication of the, vaccine, whether it's, inflammation around the heart or something else. But at the end of the day, the vaccine itself is not going to kill you. If you don't get the vaccine, you could very well die from COVID. And the numbers there are, you have 1 in maybe a 3,000 chance of getting some complication of COVID if you do not get the vaccine. So again, 1 in a million chance that you may develop a complication to the vaccine versus 1 in 3,000 chance of having something bad happen to you if you don't get the vaccine.
You just mentioned that you have your kids vaccinated, which is amazing. But the rates of vaccination amongst children, especially in the age group of 5 to 11, are quite low. One, they're worried about the heart inflammation that you just mentioned, myocarditis. The second thing they're worried about is the development of the child. And the third thing they're worried about are just the symptoms you get after getting vaccinated. Now, how do you address those concerned parents? And when you made the decision to vaccinate your children, what was your thought process like?
Look, they've developed this technology over many years. It is safe. It's effective. We have now. So for me as a parent, it gave me definitely some level of security. The fact that it's been used hundreds of millions of times already, and we have not seen any major issues.
Do you think schools perhaps should require vaccines among students, and this way we can boost up the vaccination rate?
Yeah, schools already do require vaccines, right? I mean, unless you've had your measles, mumps, rubella, and a number of other vaccines, schools will not allow you to attend or register. So this is, again, really no different. And if, this is going to be probably a state-to-state issue. And then beyond that, it may be a regional issue. But I think if states say that they want to mandate or add this onto the already large list of vaccinations that are required, I think that would make sense.
Yeah, and that would be a game changer in vaccination amongst kids if we do get those age groups vaccinated. 2 more questions left here for you. I have to ask you about our motherland, India. We have heard cases of Omicron there already. You and I both know the devastation that was caused by the second wave of the Delta surge there. The healthcare system basically collapsed. Now, how worried about are you, in regards to the healthcare system in India? And if you were to advise the government anything right now on a medical point of view, what would you say?
Again, I think thinking back to the to how bad it got in India, it's important that people there again don't let down their guard, and I would advise the government to continue advocating for masks and social distancing as best possible. Now, in a nation where you have major overcrowding in cities, that is definitely going to pose a challenge. But again, as a government, it is your responsibility to safeguard the health of your citizens. So they have to take this seriously. Banging pots and pans is not going to make the virus go away. And I think India has to also work hard on a lot of the misinformation out there. There have been lots of really crazy claims for treatments. I saw some people doing lots of different types of crazy things to try to cure COVID. But again, I think India also has to do its part to fight that misinformation.
Yeah, lots of education needed there in the world's second most populous nation. It's a lot of people. Finally, my last question to you has to be about the prediction that you have for the month of December and January. Where are you seeing different parts of the nation in terms of COVID-19?
I think, this is not rocket science. The very urban areas will get hit first, and then infections will spread from there. So, New York City, LA, San Francisco, Chicago, Miami, we will see infections rise in those areas, and then from there, branch out into the surrounding communities. December, late December and January will be bad. We will continue to see a rise in infection. Hopefully that will level off and start to decline again by late February, March.
Oh, wow. So tough months ahead for us.
Yeah.
Yes, a little bit. Well, thank you so much for your time tonight, ITV Gold.
Always a pleasure. Thank you.